My name is Alix Zacharski. I'm the nurse manager for the Medical Intensive Care Unit here at Jackson Memorial Hospital in Miami, Florida. What we are seeing now in our local hospitals is right now our numbers have gone up in hospitalizations. And what is different from the last previous pandemic is the patients are coming much younger in 20s, 30s, 40s, and 50s compared to the 60s, 70s, and 80s that we have had from the last year. That's one. Second is a great majority of them are unvaccinated. Three, patients are actually coming up with no preconditions as well. So that's scary because these patients are not, should not have been at risk really, and then here they are. But they were unvaccinated. That tells us that this virus is very aggressive. In my ICU, I've been treating COVID patients since the day one. My ICU has been expanded from 8 beds up to 37 at one point. And then it went back down to 8 beds. It just expanded last Friday, July 30th, from 8 beds to 24 beds. So it just triplicated right away. I would not be surprised if I had to expand even more so in the next 2 weeks if we hit a peak because the numbers are rising up pretty quickly. They come very sick already. They come with the respiratory issues. They just can't seem to be catching their breath is pretty much what is their major commonality. So the onset of symptoms no longer follows the 5 to 14 days incubation period, I call it. So it's more like within 5 days of they're just really sick. And then they show up to the ER really ill. They're requiring more oxygenation. They don't stay longer, trying to hold on to the low oxygenation. Then they are rapidly progressing into having to get intubated. I want you to all realize that treating COVID patients is a big thing. When we are treating all these patients, we're focusing only our efforts in this. We're actually neglecting in a certain way. We are actually unable to see other patients that are having other issues in the hospitals, not just this hospital, many other hospitals. It makes the healthcare systems to be so overwhelmed and very paralyzed in other areas of it to be able to treat other patients. Unfortunately, there's now a surplus of multiple beds or a multiple interventions and multiple equipment to be able to treat everyone at all the time. So this is a big impact that we place and a big burden that we place on other parts of the healthcare system. It is absolutely exhausting. We are very frustrated, to be honest, because we are, as anyone else, are people. We want to go back to our lives. When we go back to the hospital every day, we wear 2 masks. We are wearing the N95 mask, and when on top of that, we wear this other mask. This is the surgical mask. And to top it off, we wear the eye shield. When you work 3-4 days in an ICU or any floor for that matter, who takes care of COVID patients, is exhausting. It's physically exhausting and emotionally draining. First of all, I recommend you please vaccinate. If you're unvaccinated, I recommend you to vaccinate. Consider it seriously, as we have seen very young people dying, and really it's not worth to going through what I have seen, and I have to say goodbye to young people. Last Friday, we lost a 27-year-old and a 54-year-old side by side that were extremely ill. And it's very sad to have seen. 4 weeks ago, we lost a 24-year-old who left a 4-year-old child with our mom and with our grandparents. And so it's very difficult to see these situations, and it's not just one time. is multiple times. I'm just giving you a brief example of things that we see. I would just tell you, help us to help you. Don't let us be your nurse at this time.